Today we are going to learn about OPC poisoning. So, what is OPC? It means organophosphorus poisons. They are esters of phosphoric acid. It forms two compounds. One is alkyl phosphate, other one is aryl phosphate. Some examples for alkyl are HETP, TEPP and OMPA. For aryl it is parathion, paroxone and chlorothione. Next, we will see about the absorption. It is observed through inhalation, skin, stands for mucous membrane, and through gastrointestinal tract. The major metabolism takes place in the liver. The organophosphorus poisons get activated after entering the liver and they become toxic. The metabolites are excreted in the urine. This is metabolized by cytochrome P450 monooxidase enzyme. They are mixed with a solvent called aromax, which gives kerosene like smell in body cavity, and froth. Next, we will see about the action. The acetylcholine produced in the myoneural junction acts as a chemical neurotransmitter in the synapse, and on hydrolysis undergoes into two products, choline and acetic acid, with the help of cholinesterase enzyme. So what does the OP do? OP means organophosphorus poisons do means they inhibit these enzymes acetylcholinesterase and pseudocholinesterase. This organophosphorus poisons is inactivated by the phosphorylation. Next we will see about the symptoms. There are three symptoms. One is muscarine-like, then nicotine-like, then CNS-like manifestation. So first we will see about muscarine. For muscarine, remember there will be increased water, right? So everywhere, like in the mouth, eyes, in the bladder, there will be increased water. So salivation, lacrimation, urination, defecation, GI stress, and emesis. In the tracheobronchial tree, there will be bronchoconstriction, then increased secretions and dyspnea. In GIT, there will be vomiting, diarrhea, and pancreatitis may be present. Then there will be increased sweating, salivation, and lacrimation. In CVS, there will be reduced or increased heart rate, hypotension, and arrhythmia. And in eyes, there will be miosis and urinary incontinence in bladder. Nicotinic symptoms include contraction first, then followed by paralysis due to persistent depolarization in the striated muscle. Then in sympathetic ganglia, increased BP, increased heart rate, pallor, and mydriasis. CNS manifestations include headache, anxiety, coma, then tremors in hands, then slurred speech, then generalized weakness. There's a condition called porphyrinemia, that is chromolacriuria, which means there is increased porphyrin in the lacrimal glands, which causes red colored tears in the eyes. Next we will know the fatal dose. For TPP, the fatal dose is 50 mg IM or 100 mg orally. For OMPA or parathion, it is 80 mg IM or 175 mg orally. Malathion and diazinon is 1 gram orally. Next is fatal period. Death will occur within 24 hours if it is untreated, and death will occur in 10 days in treated cases if it is not properly treated. The cause of death will be due to respiratory arrest and respiratory weakness, and also ventricular arrhythmia. For diagnosis, 5 ml of heparinized blood is taken for determining the cholinesterase presence. So the treatment includes, first, the patient is removed from the source of exposure and the contaminated cloth is removed from the patient and washed with soap and water. And next we have to see about the airway, it should be patent. Then the stomach wash is done using potassium permanganate solution. Then atropine sulfate is used, that is 2 to 4 mg IV. This controls the muscarinic effects. So next is DAM, that is diacetyl monoxide. It crosses blood-brain barrier and it reduces nicotinic, muscarinic and CNS symptoms, which is given in the dose of 1 to 2 grams IV. Then pralidoxin plus atropine, where pralidoxin does not cross the blood-brain barrier. Then obidoxim chloride, it is more toxic than being potent. Then the convulsions are controlled by using diazepam.